So in the earlier session, you have seen the arterial supply of the brain and spinal cord. In this session, we'll be dealing with the veins of brain and spinal cord. So veins of the brain, so they drain into dural venous sinuses, ultimately which drains into the internal jugular vein. Dural venous sinuses is a separate class which has already been completed. Now let us see the characteristics of veins in the brain. So they does not follow the arteries except one, that is anterior cerebral vein, which follows the anterior cerebral artery. So these are thin walled, no muscular tissue is there in their walls, no valves are present, traverse subarachnoid space, enter obliquely into dural venous sinuses against the flow of blood to avoid collapse during raised intracranial pressure. So these are the characteristics. So what are it? They does not follow the arteries except anterior cerebral vein, thin walled, no muscular tissue, no valves, traverse subarachnoid space, and enter obliquely into dural venous sinuses against the flow of blood. So this will help prevention of collapse during raised intracranial pressure. So veins of the brain, we categorize them into cerebral veins, cerebellar veins, and veins of brainstem. So if we see the cerebral veins, which forms the main constituent of today's topic. So there are superficial cerebral veins, namely superior cerebral vein, middle cerebral vein, and inferior cerebral vein. So these are also called as external cerebral veins. So they drain the superlateral surface of the hemisphere or the surfaces of the hemisphere, mainly superficial part. Internal are deep cerebral veins, and then anterior cerebral veins. This is the only vein which corresponds with the artery in cerebrum. Okay. Then basal vein of Rosenthal. Superior cerebral veins, around 8 to 12 in number, drains upper parts of the superlateral surface and medial surface, drains into superior sagittal sinus. Anterior veins open at right angles, posterior veins open obliquely against the flow of blood. You can see here. So these are the anterior veins which are opening at right angle. Posterior veins which are more oblique, they open obliquely. Superior cerebral veins, around 8 to 12 in number. This you can see, this is the superficial middle cerebral vein. You can see here, this is the transverse sinus, this is the sigmoid sinus, this is the internal jugular vein. You can see this is the superior sagittal sinus. Middle cerebral veins, 4 veins are there, 2 on each side. Superficial middle cerebral vein, so here you can see within the lateral sulcus. It lies superficially in lateral sulcus, drains into cavernous sinus. Posteriorly communicates with superior sagittal sinus here through superior anastomotic vein of Trollard, and it communicates with transverse sinus through the inferior anastomotic vein of Labe. So deep middle cerebral vein lies deeply in the lateral sulcus on the insula, otherwise called island of Riehl, along with middle cerebral artery. So deep middle cerebral vein forms basal vein along with anterior cerebral vein and striate veins. Inferior cerebral veins, they are numerous small sized veins, drains inferior surface of cerebrum and lower parts of medial and superlateral surface of cerebrum. So mainly the inferior surface as well as lower parts of the medial and superlateral surface of cerebrum. Upper parts will be drained by the superior cerebral veins. So they drain into nearby dural venous sinuses and transverse sinus. Anterior cerebral vein, as I said earlier, it is the only vein which accompanies the artery. So drains medial surface, which is not drained by either superior cerebral veins into superior sagittal sinus or inferior cerebral veins into inferior sagittal sinus. So which is not drained by superior and inferior cerebral veins, that part will be drained by the anterior cerebral vein. So it forms basal vein along with deep middle cerebral vein and striate veins. You can see here, this is the anterior cerebral vein. You can see this is the part which is drained by the superior cerebral veins into the superior sagittal sinus. This is the part which is drained into inferior sagittal sinus. So this particular area, antermost part, which is not drained by either of these sinuses, is drained by the anterior cerebral vein. So here you can see the internal cerebral veins. You can see here the basal vein and internal cerebral veins. They are joined to form the great cerebral vein of Galen. So basal vein of Rosenthal formed at the base of the brain. You can see here. So this is the basal vein formed at the base of the brain. Near anterior perforated substance, here you can see. near the anterior perforated substance. You can see this is the anterior cerebral vein. You can see the deep middle cerebral vein, and you can see the straight veins. All three of them join to form the basal vein of Rosenthal at the anterior perforated substance, and you can trace it here. So it is going around the cerebral peduncle, medial to the uncus and parahippocampal gyrus, and then it joins the great cerebral vein of Galen. So formed at the base of the brain near anterior perforated substance, anterior cerebral vein, deep middle cerebral vein, and striate veins, three together form the basal vein of Rosenthal. Runs around midbrain, medial to the uncus and parahippocampal gyrus, terminates into great cerebral vein of Galen below the splenium of corpus callosum. Tributaries include the formative tributaries, namely the anterior cerebral vein, deep middle cerebral vein, and striate veins. It also receives veins from cerebral peduncle, uncus, parahippocampal gyrus, interpeduncular fossa structures, optic tract, and olfactory trigone, and inferior horn of the lateral ventricle. So if you see this interpeduncular fossa structures, optic tract, and olfactory trigone, all those are near to the anterior perforated substance where the basal vein is being formed. You can see this is the formation of the basal vein. You can see this is the course of the basal vein, and here you can see this is the termination of the basal vein into the great cerebral vein of Galen. Internal cerebral veins, as I shown here, these are the internal cerebral veins. Two veins, one on each side of the midline and tila choroidea of the third ventricle. So at interventricular foramen of Monro, these veins join to form the internal cerebral vein, namely thalamostriate vein. Name itself speaks, thalamostriate. The veins coming from thalamus and basal ganglia, thalamostriate vein. Then caudal vein from choroidal plexus, and septal vein from the septum pellucidum joins to form the internal cerebral vein. Beneath the splenium of corpus callosum, veins of the both sides, that is the internal cerebral veins of both sides, joins to form the great cerebral vein of Galen. You can see here, this is the choroidal vein. You can see here there is a choroidal vein. You can see there is a septal vein, choroidal vein. There is a septum pellucidum. On either side, you can see these are the septal veins, and here you can see this is the choroidal vein, and here you can see this is the thalamostriate vein draining the thalamus as well as the basal ganglia. So thalamostriate vein, choroidal vein, and the septal vein, all of them are joining to form the internal cerebral vein. You can see both internal cerebral veins are joining to form the great cerebral vein of Galen, and you can see the great cerebral vein of Galen is receiving the basal vein. Okay. So great cerebral vein of Galen, formed by internal cerebral veins beneath the splenium of corpus callosum, approximately 2 cm in length, joins with inferior sagittal sinus to form the straight sinus. You can see here, this is the great cerebral vein of Galen, joins with inferior sagittal sinus to form the straight sinus. Tributaries, internal cerebral veins are the formative tributaries, basal veins, and veins from the tectum of midbrain, veins of the inferior aspect of occipitalis of the cerebrum, and veins from cerebellum. So all these are the tributaries of great cerebral vein of Galen. Now, if you see this MR venogram lateral view, you can observe here, you can see the lateral aspect of the superior sagittal sinus. You can see the great cerebral vein, and you can see the straight sinus. You can see here the confluence of sinuses, the torcula hierophilus. You can see the transverse sinus and sigmoid sinus. This is a magnetic resonance venogram, and here you can see the magnetic resonance venogram from the frontal view. You can see this is the superior sagittal sinus. You can see the cortical veins. You can see the transverse sinus and the sigmoid sinus. You can see the confluence of sinuses. Here you can see the same venogram, MR venogram, superior view. You can see the superior sagittal sinus and the cortical veins, sigmoid sinus, transverse sinus, and the confluence of sinuses. Now here you are seeing a CT venogram. So why this is a CT venogram? You can see the bones are visible more prominently. CT is more like an X-ray. We see more bones. Okay. And here if you see MR, magnetic resonance, we see soft tissues more rather than the bone. Now, as you observe here, so this is a CT venogram. In the mid-sagittal section, we are able to see this is superior sagittal sinus. You can see the confluence of sinuses. You can see the inferior sagittal sinus. You can see the internal cerebral vein. You can see this is the straight sinus joining the confluence of sinuses. So superlateral surface of cerebrum, it is mainly drained by like this. Upper part is drained by superior cerebral veins, and the lower part is drained by inferior cerebral veins into superficial middle cerebral vein. So this superior cerebral veins drain into superior sagittal sinus. So inferior surface of the cerebrum, you can see here, this is the orbital part drained by inferior cerebral veins into superficial middle cerebral vein and anterior cerebral vein. Tentorial part, inferior cerebral veins drains into cavernous sinus, superior pectoral sinus, striate sinus, and transverse sinus. Superficial middle cerebral vein drains into the cavernous sinus, and basal vein drains into the striate sinus. This is the chief venous drainage on the inferior surface. Here you can see the medial surface, the upper part superior cerebral veins, lower part inferior cerebral veins, posterior part by great cerebral vein of Galen, and anterior part by the anterior cerebral vein. So clinical aspects in relation to the venous drainage of the cerebrum. So the most commonest venous cause or lesion caused by the venous rupture is a subdural hemorrhage. So most commonly tearing of the superior cerebral veins. These are also called bridging veins. These are the cerebral veins in the subdural space which have no support. Cause is blow on front or back of the head, resulting in excessive anterior posterior displacement of the brain within the skull, which results in tearing of superior cerebral veins, resulting in subdural hemorrhage. Then thrombosis of the intracranial venous sinuses. So it causes obstruction to venous drainage and life-threatening complications. These two are the clinical aspects related to veins of the cerebrum. So there are other brain hemorrhages which are related more to the arteries. So now you can see this is an extradural hemorrhage. Extradural hemorrhage outside the dura. So you can see the shift in the falx cerebri. Okay, because there is a space occupying lesion here. So now here you can see there is a bleeding in the subarachnoid space, subarachnoid hemorrhage. This is the subarachnoid hemorrhage in the subarachnoid cistern. Now you can see here subdural hemorrhage. So this is the subdural hemorrhage. You can see the shifting of lateral ventricles. Here you can see the intracerebral hemorrhage within the substance of the cerebrum, intracerebral hemorrhage. Now coming to the venous drainage of the spinal cord, 6 longitudinal venous channels are present as you see here. One in the anteromedian longitudinal venous channel, which is present in the anteromedian fissure, then posteromedian longitudinal venous channel present in the posteromedian sulcus. And you can see 2 anterolateral longitudinal venous channels which are behind the anterior roots, and you can see the posterolateral longitudinal venous channels which are behind the posterior root. These are the 6 venous channels, longitudinal venous channels. These channels communicate with the internal vertebral venous plexus, and the internal vertebral venous plexus communicate above with the basilar venous plexus. And this veins from the internal vertebral venous plexus will leave through the intervertebral foramina and drains into vertebral veins, posterior intercostal veins, lumbar veins, and lateral sacral veins. So overall, if you see, the entire cerebrum is drained by the cerebral veins, cerebellar veins, and veins of brainstem. All these ultimately drains into the dural venous sinuses. So the cerebral veins are external, internal, anterocerebral vein, and basal vein of Rosenthal, and great cerebral vein of Galen. So you can see here, external cerebral veins or the superficial cerebral veins are categorized in this way: superior cerebral vein, middle cerebral vein, and inferior cerebral vein. These are the deep veins, internal cerebral veins, which of the both join to form the great cerebral vein of Galen. Then anterior cerebral vein, this is the only vein which corresponds with the artery, and basal vein of Rosenthal. So these are the veins which are draining the cerebrum. You can see here these are the superior cerebral veins, superficial middle cerebral vein, and here you can see the 2 anastomoses of superficial middle cerebral vein with the superior sagittal sinus with the superior anastomotic vein of Crollard, and with the transverse sinus with the inferior anastomotic of Labe. And if we come to the venous drainage of spinal cord, chiefly there are 6 longitudinal venous channels. You can see here 1, 2, 3, 4, 5, 6 longitudinal venous channels which they communicate with the internal vertebral venous plexus, and from there veins go in different directions. So this is the venous supply of the brain and spinal cord, and the clinical aspects of the blood supply of brain and spinal cord will be the next session. Thank you.